And that registration will include my next guest here on WMBD News. Dr. Praveen Sudhindra is an internal medicine physician with Unity Point here in Central Illinois. Welcome to you. Thank you for being on the front lines of this pandemic.
Thank you for having me.
There are so many medical questions that people have, and I think as time goes on, we're starting to understand the gist of it. It's important to wash our hands. It's important to be distant. It's important to shelter at home. But there are those questions. If I get a cough or a slight fever, which things should drive me to seek medical help and which things should just make me shelter in place even more?
Yes, those are all very good questions and ones we're hearing more and more of. If you're not having significant shortness of breath, or you're not having severe diarrhea or vomiting, any flu-like symptoms that you feel like you can manage at home, you should probably stay home and isolate yourself from the rest of your family as best you can. Separate bedrooms, separate bathrooms, so on. The vast majority of people we still expect to recover after a mild illness. A minority, probably somewhere around 10% or so, seem to have a slightly more severe course. Mm-hmm. And fewer still have more severe illness. And we're starting to see those at the hospitals now. I'm also an infectious disease and critical care physician, so I have been seeing some of these patients show up in the ICU over the past week.
We understand that tests are limited, so not everyone who thinks they should have a test is actually going to get one. Let's say someone does have COVID-19 and they've taken the steps to keep themselves at home and treat as best they can. Does that make them immune? So in 2 weeks' time, could they potentially be ready to go back to the workplace?
Right. So we know from other respiratory viruses that you're probably immune from a reinfection for a short period of time. How short that is that a matter of months or a year or two, we don't know. Only time will tell. China and Italy will be instructive in that, since they've seen what looks like the worst of it before the U.S. has.
Yes, and China has started to go back to school and back to work. Restaurants are open.
So what happens in China will be very illustrative of what we can expect. But I think based on experience with other viruses, you can probably expect that there won't be any reinfections in the next few months, which should be reassuring if we see that.
This is sometimes so difficult to wrap your head around because, okay, I've been quarantined for 2 weeks and I'm going to go, but I could get sick again. We don't know. Because there are so many we don't knows, what has been the impact on the medical community?
Yeah, I think this isn't anything any of us have faced in our lifetimes, and I don't think anybody alive practicing in the medical field today can draw on any past experience to inform this, and we're learning as we go along. I think all we can go by is what data we have in front of us, because of course if you look at all the possibilities, a lot of things are possible, but all we can go by are to see what's happened before and what we're learning every day. For instance, we didn't really anticipate how many people present with diarrhea or belly pain. That's something we've noticed as we've seen more and more people show up with this.
And there have been some talk over the last week or so about a loss of taste and smell.
Yes, and that's something, again, early on that we hadn't heard of. So we were concentrating on fever, cough, shortness of breath. But now we know, as we see more and more, that there are other symptoms that we should be looking for. And I know we'll continue to learn as.
Can we talk a little bit about the why behind the what's? So why is it important that you wash your hands with soap and not just hand sanitizer for a minimum of 20 seconds?
Right, so the virus, when you cough or you sneeze, it settles down in droplets everywhere around you, usually on your hands or on your clothes and around in the immediate environment around you. And it has an envelope around it, protecting the virus, which in many ways helps us actually get rid of it easier, because if you disrupt that protective covering around it, the virus is no longer viable. So washing your hands thoroughly with soap and water rather than just spraying some hand sanitizer on it, which won't be quite as thorough, is what we think will help control it.
And if you'll allow me just a minute, an Yvonne curiosity, I had heard somewhere that protective coating was made of protein and that's why the soap helps break it down. Is that true?
It's a lipid envelope, protein and fat. So
protein
it's fat,
and
then underneath that is a protein.
So almost like the commercials for the dishwashing detergent, if you use something that's going to break down that protein and fat, you're better able to kill it.
It's exactly right.
And why don't we touch our hands and face then?
Because if you have droplets on your face and then you touch on your hands and you touch your nose or your mouth or your eyes, then those are exposed mucous membranes. So the virus can easily go and attach to the cells there and cause an infection.
And the 6 feet of distance, which is why we're so far apart today.
So the feeling is that most droplets, when you cough or you sneeze, settle somewhere in a radius of around 3 feet around you. So we kind of double that for an abundance of caution.
Excellent. Anything you think people at home should be aware of that I haven't asked you about today?
I think we can expect to see more cases as the days and weeks go by. This is by no means over. I think Central Illinois especially is just beginning to see the wave of cases here.
So we're on the front side of the curve.
I think so. So I don't think that this shelter at home is going to go away anytime in the coming days.
So we should just hunker down and take care of ourselves and take care of each other.
I think so.
Doctor, thank you so much for being with us.
Thank you
We
for
certainly
having me.
appreciate your insights. We will be right back.